Hello, welcome back to Workforce Wednesday. My name is Emily Petnato. I am the Workforce Development Specialist at the Greater Scranton Chamber of Commerce. Joining me today, I have Cindy Kennedy, Director of Community Impact and Partnership, and Amy Roberts, Senior Director of Human Resources, both from Maternal, Family, and Health Services. Thank you both for taking the time to join me today. How are you?
Good.
Cindy, why don't you start off by telling me about what you do at your organization and some of the services you provide?
Okay, so I'm the Director of Community Impact and Partnerships, and what I do is go out into the community and talk about maternal and family health services. I'll let everyone know what services we have for the community, and then also work with other agencies to see how we can collaborate with them to also help us provide more services to our community that we serve.
And I'm Amy Roberts, Senior Director of Human Resources, and I lead a team of 3 here that take care of all the human resources needs for our employees and managers here at MFHS.
I know you help a lot of families, and especially women in the community. Why don't you tell me a little bit about your mission statement?
Sure. So Maternal and Family Health is an innovative nonprofit human service organization, and we are dedicated to meeting the needs of the community through education, information, and quality care. We have several different programs. With our core values as our guide, we're fully committed to being an organization that embraces diversity, equality, inclusion, both in our workforce and in the community that we serve. And we've been doing it for 50 years in 17 counties now. We serve over 90,000 men, women, and children and families in a year in that 17 service area. Some of the programs that we provide to families are the WIC Nutrition Program, which provides nutrition education to newly pregnant moms and children up to the age of 5. It also provides them with vouchers for nutritious foods that they could get right in their grocery store. So that's an awesome program. And in that program, we employ dietitians, lactation consultants for breastfeeding, customer service representatives, and program assistants. We also have reproductive health services, which are the clinical services, which include sexual and reproductive health, cancer screening, cervical and breast cancer screening, family planning and contraceptive care, in pregnancy testing, and reproductive life planning and counseling. That program we have in 4 direct service-sized counties, and then we also have several other counties that we serve for that program. And that program employs clinical services, physicians, CRNPs, nurses, medical assistants, medical office assistants. One other clinical program, which is an awesome program, is the Nurse Family Partnership Program, which puts a highly skilled RN in the home, first-time moms. And now we've just extended the program for second-time moms. And through that program, they are provided that nurse during their pregnancy up to when the baby delivers, and then follow the baby's childhood and development with the mom and help her with parenting up to the age of 2. So that's a pretty awesome program as well. We also have maternity care services in our Scranton, Lackawanna County office. It's called the Healthy Beginnings Program, which helps pregnant women through their prenatal care with a full range of services, site ultrasounds, their medical services, and then we also provide all those other wraparound services that I just provided in that one-stop location. So those are most of our core programs. And we also have a new component with behavioral health counseling in the Lackawanna County and Luzerne County area.
Great, those are all great programs. Thank you.
You're welcome.
What are you hiring for?
So right now in Lackawanna and Luzerne County, we do have a number of openings. A few of them just actually opened up. So one position is called a program compliance specialist. And this is basically somebody who's responsible for internal and external compliance reviews. And essentially it's an LPN who might want to break from direct patient care responsibilities and work more on the administrative side. We also have a healthcare informatics specialist. So this is somebody that's going to provide expertise and support in education, development, and the enhancement of our electronic health record. So in addition to that, we have an IT analyst also just opened up, and they'll be a part of our IT team, trying to keep, of course, our technology running smoothly, which is so important today. And then we have our behavioral health clinic lead. And this person is basically a licensed clinical social worker. So as such, they're going to manage a caseload, but they're also going to have some supervisory and leadership role in advancing our behavioral health programs and services throughout MFHS. A couple more openings we have are in the healthcare realm. We have a certified registered nurse practitioner available in Scranton and a part-time one available in Hazleton. And then we also have a RN or care coordinator, as we call them, also up in our Scranton facility at the Circle of Care.
So are most of these positions require some kind of license? Are there any that don't?
The program compliance specialist is an LPN, as I mentioned. Of course, the nurse practitioner would be a licensed position. The social worker would be a licensed position. The IT person would need a education, a bachelor's degree in information systems or computer programming. And for the most part, that's about it.
Can you explain some of the benefits to these positions?
Sure. So we try really hard to keep a very competitive compensation and benefits package. And one of the things that I think we excel with is our focus on a work-life balance. So a lot of times for the healthcare positions, especially, they're used to working weekends, they're used to working holidays and evenings, and we're able to provide a lot more family-friendly work hours. So that's something we focus on, as well as generous paid time off. We also have 11 paid holidays. We do recognition and reward programs. We offer premium health insurance to our employees and their families. We do have a great 401k that matches 6% of up to 6% of your salary at $1 for dollar. And then we have company paid life and disability insurances as well. And I think the other nice benefit we offer really has to do with our culture. We have a wonderfully collaborative culture, a very compassionate and caring culture. And it's something that really is evident when new hires come in. It's something that we hear often spoke about on our employee surveys, where our employees are actually saying things like, you know, we have an uncommonly dedicated, friendly, and supportive staff. Our staff are passionate, they're motivating, they're inspirational. So we love to hear those quotes come back from our employees.
That's great. Can you provide me an example of some of the ways you recognize your employees?
Sure. We do service award recognitions. So that's just, I'm sure a lot of companies do that as well. But we do look to, I think, publicly support our employees is as a way of recognition. So we tend to cheer each other on when people get certified with different degrees or they complete different training courses. We're always the first to cheer them on. We make sure that those announcements are made and that everybody knows about that. And we support those efforts behind the scenes as well.
Nice. Is there anything else you would like to add about your company culture or the positions you have available?
Nothing specifically. Again, just that I think, you know, we do tend to focus on the C's of care, compassion, collaboration, commitment, and it's part of our mission. And I do think it really does live within all of us. So in deciding to come work for MFHS, I think there will definitely be a sense of reward in the work that you do, and we all feel that. So I think it's contagious in that respect, and it's a really wonderful place to work.
Cindy, is there anything you would like to add?
Yes, I would just
about your locations.
Sure. So in Lackawanna County, we have locations at Circle of Care 640 Madison Avenue, That is their circle of care that employs all of those programs in one location. Then we also have a WIC Nutrition Center on 431 Wright Court, which is WIC Nutrition Services in Luzerne County. We have a clinical services, reproductive health, and WIC Center on 3 West Chestnut Street, 10 West Chestnut Street, excuse me, in Hazleton. And then also in Wilkes-Barre, we have a WIC Center also on Old River Road. So we do have another location there. So if you were interested in Luzerne and Lackawanna County, those are the centers in that area. And I would like to reiterate with Amy said, I've been here 15 years. Some of the coworkers that I have worked with at Circle of Care have been here for 25 plus years with the agency. And as far as rewarding work is concerned, we see families here that are generational, that their mother came here. Now the granddaughter's coming here. So we tend to have the community come back time and time again. And I think that speaks a lot to the employees that work here in maternal and family health. You would be proud to work here.
So I'm sure after listening to all of this, there has to be an interested job seeker. So Amy, why don't you tell me a little bit how you can apply?
Sure. If you visit our website at mfhs.org, up at the top, there is a careers tab. So if you do click on that, you will see a list of all the openings we have available throughout the 17 county network, including some of the ones I just spoke about that are in Lackawanna and Luzerne County. And you can click on any opening that interests you and get some additional details in terms of the job qualifications and what exactly that job is. We also have a new feature that's kind of a quick apply. So if you don't have time to go through a complete application, you can just give us some essential contact information and somebody from Human Resources will reach out to you, talk to you a little bit and see if it's worth you going ahead and filling out the complete application. So we try to make it as easy as possible.
Nice. So Cindy and Amy, thank you so much again for joining me today. If you are an interested job seeker looking to learn more or to apply at Maternal Family and Health Services, please visit mfhs.org to learn more. If you are a business owner interested in registering for an upcoming Workforce Wednesday session or would like to learn more about Workforce Wednesday, please contact me at epetnato@scrantonchamber.com or call 570-342-7711. To learn more about Workforce Wednesday, view some of the past sessions, and view available job positions from more of our member businesses on our job board, please head to scrantonchamber.com. Thank you again for joining us today, and please tune in next week at noon with McLean. Bye. Thank you.
Bye. Thank you.
Thank you.